The AHEC network is all about health workforce development. We literally impact every angle of the spectrum to provide the best quality of care possible.
It was a program that was going to be brought to our community to help improve the number of providers in the community.
Enriching the future pool of healthcare practitioners who then can meet those needs of that diverse population.
Working with young people and working in healthcare. And AHEC provided the opportunity to bring those two together in an amazing and wonderful kind of way.
I just thought to myself, these are my people and I'm at the right place.
The passion for the work that we do, why it's important and how it's impacting and making a difference in individuals and communities' lives.
We've been focused on training and strengthening and developing that workforce for 50 years. And hopefully we'll be doing it for 50 more years.
The founding of AHEC was part of a movement probably from the mid-1960s to the early 1970s.
There was an explosive population growth in the country following World War II, the baby boom. And there was great concern around the country that there would not be enough health professionals to care for the population.
The healthcare outcomes in the United States were not as good as they could be. And there was a lot of access issues, trying to figure out how to do a better job of delivering healthcare to individuals who needed that healthcare. But one of the questions that became central to a lot of the developments that are we training the right people with the right skills to do the job that needs to be done.
And people in Congress and other health planners that were concerned about rural communities and other shortage areas recognized that if there was going to be a shortage of health professionals, a supply for the whole country, it would really be exacerbated and really problematic in underserved communities. Something had to be done.
So the Carnegie Commission looked at that and said, well, here's an idea. And that idea, they termed the Area Health Education Center.
Very soon after the Carnegie Commission report, the support for the AHEC concept spread widely. In 1971, President Richard Nixon, in his health address to the Congress, supported the development of AHECs around the country. In 1972, the very first AHEC programs were funded.
Nobody knew what an AHEC was. At that point in time, it was a very vague notion in a certain sense. The Carnegie Commission saw it as a mechanism to provide patient care, to provide education and continuing education in communities.
The primary mission of AHEC was to build partnerships between academic institutions and underserved communities to leverage the resources of the academic health centers with the providers in underserved communities to increase the supply, distribution, and quality of the workforce. In 1972, what was then the U.S. Department of Health, Education, and Welfare started the first 11 programs, and we fondly refer to them as the first generation.
Now, a number of those 11 programs, over the period of time that they were funded, some dropped out. Some decided, well, we really can't do this, or this wasn't really what we thought we signed up for. But a number of the programs did, and we still have some of those programs in existence as AHECs today. So when they funded this generation of programs, they funded 12 programs between 1978 and 1988, there were more requirements. It just became a more structured program.
In 1985 till about 1995, the third generation of AHECs started. From 1995 until today, it's what's been called the fourth and fifth generation AHECs. The original programs were strictly focused on underserved rural communities. And in the later generations, they expanded to include urban inner city communities as well.
So the AHEC network is all about health workforce development. We literally impact every angle of the spectrum, from working with kids and getting them interested in healthcare to helping support current healthcare professionals and make sure their skills are up to par. The thing about the AHECs that really makes that a unique partner that you want at the table is not only do we have access to the future and the current healthcare workforce, but we also have access to communities.
The strength, in a sense, of the AHEC programs is in the regional and community-based networks. They're the ones who are closer to the people. They're closer to the needs in many respects. They're also closer to the political structure. And if we're going to maintain an academic community partnership, we need federal, state, and local participation.
We reached 644,000 participants last year. We really are a big part of this nation's healthcare system. And the chances are that if you've seen a healthcare provider in the last year or two, that provider or clinician has been touched by AHEC in some way.
The scope of AHEC has changed tremendously in the last year due to COVID. But I think what we have found as AHECs are very nimble. I mean, when we're asked to pivot, we pivot, and we pivot well.
I think it highlighted and showcased the capability of AHEC centers and AHEC program offices.
We stepped up and proactively looked for ways that we could chip in and help out.
Out there in the public, they think they know what an AHEC is, but I think because of this pandemic, they know what an AHEC is and how we can contribute.
We are here. We've been addressing these issues of healthcare professional shortages for 50 years. We have the pieces in place. We've been a part of that infrastructure, helping those underserved communities for so long.
The other interesting thing about the AHECs now, as we look forward, is the states are looking to maintain the workforce that was built because of COVID. We don't want to find ourselves in the future in a place where another pandemic comes or there's a huge emergency disaster because of a natural disaster that occurs, and we don't have the public health workforce that we have now. I think that the pandemic has shed light on the lack of infrastructure we have in public health and the strength of the AHECs in building that infrastructure. The National AHEC Organization is a group of AHEC professionals from across the nation. The National AHEC has been created to provide all of these professionals with a place to come together, support each other, share resources, and really improve their ability to respond to the mission that we have.
So AHEC has been around for 50 years. The National AHEC Organization has only been around since 1997. NAO was started to be that sort of connective tissue to work for the good of the whole.
I think the strength and the connectivity of the National AHEC Organization is its centers and its center directors. Knowing that you have this network of folk, this large network, there are over 200 centers across the country, AHEC centers, that you have these colleagues, folks that have been in the business, in the AHEC world for a long time, people that are fairly new, that there are people at various levels that can actually support you.
We support each other. We have no mandate to do that, but when you're part of the National AHEC network, you could pick up the phone and call the Massachusetts AHEC, the Utah AHEC, or wherever it might be, to troubleshoot with them about what they might be experiencing in their region.
Getting lots of ideas from each other around the country. It's been a wonderful addition to our program.
Just kind of learning how to have a perspective outside of your region, understanding that, your challenges are not your own. Always there's someone else across the nation that may be having the same barriers and the challenges that you may have. I have not been more impressed with a national organization as I have been with the National AHEC Organization.
One of the ways that AHECs have changed in the last few years is the implementation of AHEC Scholars.
Starting in 2017, the AHECs across the nation were tasked with creating an AHEC Scholars program. The AHEC Scholars program provides more immediate results because you're working with a student that's already enrolled in a health program of study.
These are students who they graduate level health profession students who are in medical school, nursing school, those kinds of programs, and helping them to work in medically underserved communities.
The overarching goal there is to immerse them into the communities that they live. The intention is that we can incentivize them enough to stay within those communities.
Well, we know that our most rural and underserved communities simply do not have access to the educational resources, even to the healthcare facilities and providers that many of our more urban centers do. So the AHECs, through pipeline programming, get kids from those communities interested in even the thought, just plant the seed of perhaps that student thinking about healthcare as an option for them. And when I say healthcare, I mean all of healthcare.
I love our doctors, we need our doctors. I love our nurses, we need our nurses. But we also need dietitians and therapists and counselors.
Every AHEC to some degree has at least a high school pipeline program. And the focus there is health professions, education, exposure, and experience.
It looks different in every state. It looks different in every region because it's customized to those local regions.
What the pipeline has done for us, and certainly with the addition of the Scholars Program, I believe it's allowed us to stand out in front of the employers. That has really resulted in some tremendous funding opportunities because the employers now see an AHEC program participant as a true asset to their organization.
There's a major need for physicians around the U.S. And I think AHEC's main mission and goal is right on point. They want to train physicians who are willing to go and serve in the underserved areas.
I would hope that 50 years from now, we would have a very diverse workforce in healthcare.
So in the next 50 years, I look for AHEC to continue to grow, continue to expand, and I think over time, more and more people will understand the value of the AHEC mission.
I am excited that we are celebrating our 50th year, and I'm even more excited about the next 50 years. I think AHECs have become a known entity with schools, with our communities, with professional organizations. We are among the first that is being called to the table because the confidence is there that we'll get the work done.
I hope that AHEC is able to decrease the burden of healthcare access and rural healthcare in the future. You know, it's a long-term goal. It's not something that's going to be fixed overnight. But if they're able to even decrease that burden by a little bit, you are helping so many people who have poor access to care. So many people who need a physician who's willing to just talk to them. And I hope over the next 50 years, AHEC is able to be a part of that story.
We have been able to develop a network of people that we all want the same thing. We want a better community.
We're building a community. And that's always been really what the AHEC mission is about. The National AHEC Organization, it's a community. We have layers upon layers upon layers of community within what we do. And all of those are to better serve communities.